So, hi everyone, and welcome back to the fourth episode of the podcast with Ashley and Kelly. So, previously we were joined with Supreet, a medical office manager, to discuss senior in the world of virtual health. Today, we're shifting gears to investigate Dr. Singhal's journey in discovering Cortico health technologies. Dr. Singhal is a very reputable family doctor from West Easton Medical Clinic in Richmond, BC, who has been practicing for over 25 years.
So thanks for joining us today, Dr. Singhal. Could you tell us a little bit about yourself?
Sure. I've been in medical practice. I've been reminded for at least a quarter century, so that seems like a little bit of time. I'm a family doctor, and I used to do different areas of consultancy, called GP consultancy practice in different areas. And at least for 21 years, I've been running a group family practice slash walk-in. And so we've always been a very busy practice. And we have multiple doctors, and we cover for one another. We see each other's patients, and we do longitudinal long-term care and provide hopefully best practices. As a principal physician, I've supervised a few physicians. Being offered a second cup of coffee, I think. But anyways, which I haven't finished the first. Thank you, though. So yeah, it's a very good family practice and a group of us, and we've adapted to the new changes with the pandemic and how we've come about to do things.
Dr. Singhal, I just wanted to say thank you for providing such quality patient care throughout the years. You just mentioned the pandemic. Can you tell us a little bit about some of the challenges that your practice and yourself has faced during these difficult times?
You bring back a lot of memories now. It was about we had just ended a lease with our practice. We had about 1,200 square feet for six practitioners. We had another space where we had midwives, and that was a very small space. That we ended our lease January 31st, 2020. And so for February 2020 and potentially March 2020, we were doing everything we could to see patients. Some of us would be in on a Saturday, some would be in on a Sunday, 3 of us would be in on Monday, and 3 of us would be in a Friday. So we could just use the space we had. So we could just kind of all use it. And in addition to midwives, so there was about 7 odd practitioners using this small space. And then the lockdown sort of thing happened, where it was, you know what, you cannot come face to face, you must do telehealth. And I have to actually commend the doctors of BC. They've done just a tremendous, fantastic job in encouraging telehealth, developing tools, giving us the wherewithal to kind of, this is how we're going to have to do it. And with good reason, so that we could keep the COVID numbers down and this sort of thing while seeing patients. And the reality is that a large part of medical diagnosis is asking the right questions, is taking a proper history. And yes, we do need to do physical exam at times. We do need to see things at times and touch and feel and listen and what have you. But I think other tools have developed from then till now that has allowed us to do that in a safe way. Now, at this stage, November 2021, there is some lifting, and over the last number of months, we are seeing patients more in person, but definitely telehealth is a large percentage of how we see patients. So it was a lifesaver in terms of our practice, in terms of the only silver lining of this awful pandemic was that the small space we had could accommodate so many practitioners because of telehealth. And we're developing some other office space, so we will have that soon. But it's due to those construction delays, it's got us through all of this.
Yeah, so I guess it's interesting that you brought up the timing of when the pandemic started, because as the pandemic started in the beginning of the year, things are probably many clinics and other companies as well are rolling out new things, but it kind of interrupted from the get-go. And so I just kind of wanted to get to know a little bit about your first experience using telehealth. Was it at the start of the pandemic, or have you been using telehealth prior to the pandemic?
That's a really good question. So let's go back 2 years. 2 years ago, November 2019, I would have done zero telehealth in November 2019, prior to the pandemic. And I don't think many were doing it at all. I mean, there was some, but really not a lot. The pandemic was a great catalyst for telehealth, if anything positive can be said about it. So initially we started with Doxy and Me, or Doxy or what have you. And then the doctors of BC advised us, hey, we've got encrypted Zoom for you. So a high-end sort of Zoom. So it certainly started to use some Zoom, although I was very comfortable on the telephone. I mean, I've known patients for 20 years, and I've known the families for a very long time period. So it wasn't a large kind of undertaking to just listen to the intonation of a tone on the phone, and I can kind of see a facial expression while I'm listening. So I mean, largely just from a ergonomic perspective, the phone is an easier tool. And I guess there's other things that have rolled out. So just that the practicalities. So in other words, I don't even use initially I was using a phone with a *67 so that people wouldn't know my personal number. Then it was FongoWorks. So we all on FongoWorks, the voice over internet protocol with a message on it. So the patient misses your call, they can dial that number, but they won't be calling you personally, which would be very interruptive and not practical. So they will have our office number. So our staff will then be able to speak to the patient. So there's a bunch of things there technology-wise that occurred very quickly. The doctors of BC also encouraged SR fax. So we've used that and integrated that with our EMR. So we can fax prescriptions, fax requisitions, do all those sorts of things that you would think initially, well, hey, you have to be in person, we have to hand that to you. Or also for dermatology things, for instance, emails of your photos or email of different sort of things and upload it into the chart. If we couldn't use Zoom, if we couldn't, for whatever reason, we wanted multiple pieces of information, that started to happen. I have an app now called DermCam, where it's like a text. If I call you and you're wondering, how can I assess you, your dermatological issue or your cosmetic issue or whatever, hey, how would you do that over the phone? Well, you do it with a text and you can take a picture, or I can Zoom you or whatever, or other platforms within Cortico, which I have yet to use, but hopefully we'll be using at some point. But all those sorts of things have allowed. If you'd asked me 2 years ago, how would you do it? I would have been wondering, how would we do it? Within really a very short time period, probably 2 to 4 months, all these tools have been developed where it's just, hey, this is the new normal of how we do things. And it's surprising just how much can be done through telehealth versus in person. And it's largely the patient who may not get it, that, oh, I've got some whatever condition, I need to be seen in person. Well, yes and no. You can't do procedures over the phone. You can't do, a digital rectal exam or a pap smear or breast exam or whatever over the phone. But for a lot of the other things you can. And of course, if something isn't measuring up, then you want to bring them in anyways. If you really have to, you'll do that, and out of safety and so on. So we work in a group, so we do have the luxury of having a doctor on site in person every day. So if we do need to see someone in person, we have that ability to do that.
So, that's really good to know, Dr. Singhal. Now, not every single doctor, could be tech savvy. And, there are numbers of practitioners, all over Canada that are still kind of hesitant on using telehealth. Is there any words that you could encourage, these, practitioners on, starting to use telehealth?
Oh yeah, the feedback that we get, and I have practitioners who are like 12 years older than me and 12 years younger than me and all in between. And The learning curve isn't that steep. I mean, it's not that difficult. I mean, I think the days of the solo practitioner are like the dodo bird. I mean, they're not going to be, if they are out there and doing it, I don't think that's going to last long. You need to have a group where a lot of the technology, and you need to have the right kind of tools, like with anything. And the tools that are in existence is not rocket science to learn. I mean, I would say within 2 to 3 months, our infrastructure was reasonably set in terms of being able to do some degree of telehealth. The practitioners who are not doing it, I just wonder what the hesitancy is, or like what is the roadblock or stumbling block to get there. Some of it, go ahead, sorry.
Do you think, Dr. Singhal, that is it more of a security thing, or is it more so that their patients, like, I mean, there's geriatric doctors, worried about their geriatric patients, not being tech savvy. So, there's some hesitance on that as well.
That's very true. I mean, the patient base has to also be comfortable with the whole concept. And so it is a two-way street, right? I mean, you both have to kind of feel comfortable. So a lot of patients will be, why weren't we doing this 10 years ago? I mean, do we say we have great access of healthcare in Canada? Yes and no. We do, but you have to take half a day off of your work. You have to go find parking. You have to kind of wait in the waiting area. Versus for a lot of things, you could be called on the phone, and a lot of what you need to do could be done without interrupting your whole day. Mm-hmm. And I think there are times, like with anything, that you can't have everything perfect all the time. I mean, so there are some, especially you're right. I mean, it depends on the type of practice you do. If you're doing a geriatric practice, you want to do a complete physical exam. Well, yes, you've got to have that person in front of you for many things. And there are technical tools that allow you to have listen to the heart sounds and things like that. We don't use them. We don't incorporate them. They were around with a previous company was trying to do this years ago to have virtual care, which never really took off prior to the pandemic. But what we're doing now, I mean, the hesitancy has to do a little, you're right, it has to do a bit with the patient and a bit with the practitioner. And I think, again, if you'd asked me 2 years ago, I would have been saying something entirely different but after 2 years of kind of doing a lot of this and developing more tools, things like DermCam and other things where we're not compromising safety, the feedback I get is largely 90+% that telehealth we should have done it before. But that's from the patients. Mm-hmm. And from the physicians is also, hey, this is really a good thing. Why haven't we been doing this sooner? There's times, I think, where, of course, with the pandemic is another variable here, where the adaptation of how you used to do things to how you're doing things now might be a little different as well. Whereas if someone's right in front of you, it doesn't take much to say, well, okay, let's examine this or this, right? And when you're doing it remotely or from telehealth, you have to try to think a little bit and coordinate to see somebody to examine them. And that's probably a little bit of a workflow difference. And I would hope and think we're not compromising anything in every scenario by coming to that decision point that this can be done in a virtual way. This cannot be done in a virtual way. So a good example is for dermatological things, where many will think, well, how on earth can you do that over the phone? I used to initially use email to get pictures sent, because the phones now that everybody has, almost everybody has, there might be like a handful of people who don't have email, a handful of people who don't have a smartphone, and for them, there's other ways, if it were, but the vast majority of people do have email and smartphones. So DermCam at point of care, text a picture to me right away. And Cortico does have a video link as well that can be helpful, or Zoom or whatever that can be used. And then if not, well, look, I need to see you in person, and I have to have you come in. or one of my colleagues will see you. If it's an emergent matter, we'll see you today or tomorrow, you know, in whatever setting that may be.
That's awesome.
Yeah.
Kelly, do you want to ask how long he's been using Cortico for and how it differentiates from other platforms?
You have to remind me how long I've been using it for. So like half a year or so, or how long? 6 months. Okay.
Yeah, Aaron was saying half a year or so.
Yeah, I heard that. Yeah, he's in the background here.
So Kelly can ask this question.
He's the one who brought me tea on top of my coffee. 1 second here.
No worries, take your time. So then Kelly, I'll wrap it up.
I'm a caffeine junkie, I think. Let me see here. Here you go. There you go.
Okay.
Thanks. Okay. Go ahead.
Yeah, so perfect. So how long have you been using Cortico, Dr. Singhal?
I believe it's been about half a year now, and very, very nice tool. What we were using prior for the online booking has been really, really, really nice. That the workflow that I would have is typically when I see a patient, if I need to do a follow-up, I would physically, as a practitioner, move the patient, say, oh, I'm going to book, well, let's book you in here. The feedback would be, often would be, well, I've got dance rehearsal that day and that time, and can I move it here, or something like that. It's so much, I mean, that all that adds up. And so it's nice to, you know, and it's nice also for our staff not to go through that process, to kind of have a patient, you know, just say, or just to say, look, rebook with me in 2 weeks or something. Just go to our website and go online and do that. And so that saves the practitioner's time, and it saves the staff's time, and it just, you know, it's just an exceptional use. It streamlines things very well.
Dr. Singhal, what differentiates Cortico from, you know, some of the past telehealth services that you were using in the past?
You're talking about for online booking. For online booking, yeah. So for the nice thing about Cortico is that from what we were using prior, didn't require staff to kind of okay the patient. So that would be a tremendous staffing issue. So Cortico is much easier. Patients can do everything themselves, and they don't have to have the staff okay it. And so that there's a huge bottleneck with the previous sort of scenario. And the patient can register themselves with Cortico, which is even better.
Yes, that's correct. So any booking of appointments, counseling appointments, and also, like you said, if they're new patients and they want to kind of start a new file at your clinic, then that is definitely an option as well. Another thing that I wanted to mention was, do you think Cortico is a customizable platform for your clinic?
I think it is. We've got a psychiatrist with us, and then a family doctor who is part of a program, a government program where they book patients differently. It's called a PCN, or Primary Care Network program, and the needs are different for them compared to the regular fee-for-service family doctor. And even there's subtle differences between myself, who's usually fully booked with appointments, and my colleague who might have more openings and might have more of a walk-in basis or can absorb the walk-in practice. We just have different styles and different things that we're doing. And so I guess to an extent, so to reflect those needs, I believe we've worked with Cortico to try to more customize solutions to those issues.
Amazing. Did you want to ask about the streamline communication, Kelly?
Yes, I just kind of wanted to ask about, one last thing I wanted to ask was regarding, you were just kind of saying that, you know, especially with virtual health, communicating with patients is very, very, is key because you can't really see them in person. So what do you think about streamlined communication that Cortico has to offer?
So, I mean, I think there's a few things. I think some things are a bit in development in terms of the email. At a practical level, what you'll want to do, your workflow is often you'll want to get some type of an assessment. And the first thing is, I mean, can you do that without seeing somebody? Therefore, telephone or what have you, the oldest, telecommunication. Then the decision is if you're wanting video, which so you can see someone through video through the Cortico platform, or whatever. There's other video platforms, but if that can be incorporated. But a one platform will be better than a 6 platforms that you're working with in the day. So what I really find exciting is the email development in terms of emailing requisitions. So I think that would be, x-rays, lab requisitions. I fax things to the hospital like CT scans, MRIs, etc. It would be nice also to email patients those requisitions or whatever, but that we would fax there so that if they have it, then if they want to follow up, they can follow up. So our staff, that sort of thing. And so I'm looking forward to the email components really working better or being developed rather to work in a workflow pattern. And that's exciting. And I hope that comes to fruition. So what else am I thinking here? The video parts of it, and maybe Kelly remind me some of the other components that we might be thinking of here.
All the bells and whistles, Kelly, let them know. So Dr. Singhal, some clinics that, are not using Cortico, is there any, encouraging words you can say that can encourage clinics to start using Cortico?
Yeah, I mean, we've been very happy. I think there's a lot of services that Cortico offers that, and in the marketplace maybe is positioned to do things in a certain way that would be very beneficial. I'd mentioned about the online booking. First of all, is the bread and butter, and not every EMR system has an online booking system, and we've had that with previous EMRs. We changed providers, and then with the other provider, it was not their forte, and that was there's only a few Oscar service providers right now, but the Cortico has a really fairly robust ability to lessen staff involvement. So, a patient can book themselves, can move things around. That frees up staff time to do other more important things, if it were. Hopefully, to make the telephone appointment booking a thing of the past. If we can free up our staff to not answer the phone, not go through, 5 minutes, 10 minutes of just to try to book an appointment, someone looking at their calendar, flipping the pages open and what have you, that's a win, right? That's a win for everybody. And so that's right off the bat. If that can be accomplished and accomplished well, with minimal staff involvement and minimal time, that's what the advantage of Cortico would be. It's saving staff time and saving practitioner time. That's a win on all fronts. And then the tools that are involved with Cortico being integrated with the EMR, sending requisitions, doing things that automates the system. So the current system would be a lot of practitioners, especially for multi-practitioner offices, would rely on the staffing, that they would be sending a tickler or a message. Can you email out this and this and this to the patient? Can you follow up this here and here? That takes a lot of staffing time, and that interrupts a lot of the workflow as well. So if that can be automated and function well, that's a no-brainer as well. Mm-hmm. That's kudos to Cortico as well, because that would that does allow staff to do other things that they do that a lot of practitioners don't know what staff are doing. Like,
yeah,
there's the front end work, there's the back end work. I'm speaking like a manager now and then, but the front end work is what people see. What are you doing? You're answering the phones, patients are calling, you're emailing or faxing requisitions, you're trying to book an appointment. In reality, a few clicks of a mouse ought to take care of a lot of those sorts of things.
Dr. Singhal, do you think that I was looking at some statistics recently with Kelly, and there's a high percentage of staff burnout, MOA burnout, frontline workers burnout, and it's taking a toll on a lot of people's mental health. Choosing Cortico, do you think you prevented a lot of staff burnout for your front staff?
I think it's definitely helpful because in terms of lessening the day-to-day challenges. I mean, especially it piles up, right? Stuff piles up. If there's 5, 6 practitioners, they're all asking staff to email this or fax that. That becomes 300 requests. If that, or to book appointments, and that adds up as well. So I mean, the key word I would say is asynchronous. If we can make things from synchronous to asynchronous, meaning we don't have to have 20 phone calls Monday morning 9 a.m. or 50 or 100 phone calls 9 a.m. If you can spread that out, like, look, this is not urgent or emergent. Can we do this by email or other means, or do a few mouse clicks? If it adds up, if it can't be done today, it can be done tomorrow. When there's time to do it, when there's not a busy phone rush or a busy in-person session, that's just good management, and that's good use of time and use of staff time. And so I would say aiming towards making those tasks more efficient and more asynchronous when we don't need to do synchronous. We don't have to all have it all synchronously done, if that makes any sense. Yeah. So I mean, Cortico is a good tool to try to hopefully achieve that.
Awesome. So you, in the beginning, you mentioned, practitioners should have started using telehealth earlier. What do you think the future has in hold for virtual health?
Okay, let's go back historically a little bit. Before the pandemic, if there were billing codes to use telehealth, they were not well known. There was at a practical level, the billing codes and so on were such that in-person visits were much the norm, and the culture just wasn't there. The pandemic has been a catalyst to show us, hey, there is a better mousetrap. There is a better way to do things. So the authorizing bodies or colleges or so on have their own mandates in terms of the public, and there's certain members of the public will want, hey, no, I'm retired, I don't mind, I want to come in person, and I don't know how any of this, I don't know how an email works, I don't know how to use a smartphone or what have you, and I want to handwrite a letter to you. And I mean, the technology is there where we don't use telegraph anymore. We don't use smoke signals, right? We use technology for what we have. We've got emails, and even that is, we've got texts on our different apps that we can communicate, images and things like that in an instant. So the reality is technology is developed. We have the means and the tools that weren't around maybe 5 years ago even. And so I can't help but think, when technology has been advanced to this degree, why would we purposefully say, no, we shouldn't use it in healthcare? So we were one of the first to use electronic medical records in 2005. We had developed our own medical records. At that time, so that was different than any of the major producers. This was, we had people who were doing it with us, but I'm sure it was very customized electronic medical record system. And I think some people, if they weren't familiar with it, they would need training to use it and things like that. But it was a no-brainer. I mean, this is a technology that was used in the airline industries, that was used in banking and all reputable industries. And why on earth were we seeing people using paper and charts and walls filled up with charting that you'd need 3 people to find it and give it to you? So right from the start, 2005, I'd say, is when we started with electronic records. People would look at me funny, say, how on earth can you have two staff to support so many practitioners? Well, they're not hunting for paper records. they're not then trying to file the papers in that way. Even when we were building our office, the architect was pointing at me and laughing and saying, well, why are you why do you have such little chart space? You realize that you need 6 times the amount of chart space.
You need a library.
Yeah, and exactly. And I was saying, well, let's make sure we have data jacks in every room. Let's make sure that we're networked. What's network? Or, I mean, or something like that. I mean, that, but yeah, there was some laughter at the beginning, but now, of course, everybody is using electronic medical records, and it would be unusual. I mean, we see it still. There are practitioners who are using paper records who just started retiring, and they're sending their paper records to us because we take on their patients. And we
you gotta scan them all.
Yeah, I would say sometime going back historically, sometime in 2007 is when we started shredding all the paper. So we, whatever little space was there was actually starting, the architect might have been partly right, because they were starting to get filled up. And so, but we scanned it all and then shredded it all. And so we cleared it all out. And so we had more than ample space. And so now, people, a lot of my colleagues wonder, how do you have practitioners with this much space? Well, it's all computerized, it's all digitalized, and there's robust backup systems, there's all these sorts of things, but everyone, I think, is now doing it. It's not a foreign concept to have electronic medical records. I would say 80-90% are doing it now, right? But then there's why I go there is that there's other tools that are there now too, and including online booking, including other automation. And you're right, the frontline workers in healthcare are burnt out. It is a challenging job. It's a very challenging job to be a medical office assistant. And anyone who says, oh, that's brainless work or easy work or whatever, doesn't know the system. Patients are very demanding. They're very worried. They're very, and maybe they should be, maybe they shouldn't be. But the communication levels between practitioners, patients, and then it all somehow can move towards the medical office assistant in terms of that worry. And so tools and systems have to be in place to efficiently and reasonably communicate with patients. And if, kind of I've touched on this, if there's 50 people trying to call 9 a.m. or, with some, in their mind, urgency, if that can be done in a much better way, where it can be asynchronous and we can address their concerns through communication, whether that be, here, you can book an appointment this way, speak to the physician, just with a few mouse clicks, and their issue is being resolved or assessed. That's lessening the burden of burnout on the staff as well as the practitioners, and it reduces tension, and it makes a more harmonious, easy way to function. So I hope I'm answering your question. Am I doing so?
Yes. Kelly, you're going to wrap it up, right?
Yes.
I mean, by all means, ask a follow-up if I somehow evaded the question.
No, it was great.
You're doing awesome. You're doing awesome, Dr. Singhal.
Really good.
You need to be on TV.
Yeah, I just wanted to kind of add that definitely technology and all these innovations are it's kind of like a blessing in disguise, because in terms of kind of building more of these technologies, that means we are bringing more efficiency. However, we need to kind of pay attention to like the mental health and well-beings of these frontline workers like you and the staffs at your clinic. And so from the kind of era of phone appointments and now to video appointments and kind of more of these appointments kind of growing, Cortico really, really values a healthy clinic environment. So whether that is reducing the number of phone calls, we believe that reduces stress on MOAs and doctors as well. So kind of creating a manageable clinic environment where it's, even I think these phone rings and phone calls affect patients as well in the waiting room. So definitely all these things really add up in kind of creating a healthy or unhealthy clinic environment. And so, yes, Ashley, did you have anything else to add? All right, Ashley, do you have anything else to add?
No, I think that Dr. Singhal covered all of our key points today. And I just wanted to say thank you for taking the time out to sit down with us today to discuss, virtual health. And Kelly, did you have anything to add?
No, I think we're good. It was a pleasure speaking with you, Dr. Singhal. And thanks for everyone for watching, and see you in the next podcast. Bye.
Thank you, Dr. Singhal.
Okay, thank you then. Hey.